Hello again. I'm Dr. J.C. Smith in wonderful Warner Robins, Georgia. Today I'd like to talk to you about the biggest scam in healthcare, and that's back surgery. And today I've got a lot of information to prove my point, because I know just my word alone is not going to be that impactful. But this is not a new issue. Since the early 90s, it's been well known that all these back surgeries, most of them are unnecessary. There's been guidelines produced saying the same thing. But as we've learned in America's for-profit healthcare, doctors don't follow guidelines, they follow the money. But let me give you a little backstory, the history of this whole back surgery scam. If you want to learn more, and I hope you do, go to my website, chiropractorsforfairjournalism.com. And there I've posted over 575 articles over my 40 years that I've written that will get you up the learning curve, because again, there's a ton of information. The research is abundant, but it's not getting the American public because the American medical press isn't telling you. That's why I wrote my second book, To Kill a Chiropractor, after To Kill a Mockingbird, the media war against chiropractors. I mean, the evidence is there. And again, the alternatives are cited are there. But again, the medical men and women who do the medical news, first of all, are chirophobic. They've got an attitude against chiropractic because that's how they were brought up to be. That's what medical schools do to people. And second of all, their sponsors, Big Pharma. And believe me, Big Pharma does not want you to know any non-drug solution to healthcare. It's just remarkable. Last year, in 2018, the New York Times did a study on drug TV ads, and that one year there were almost 1 million ads, and which equated to 3,000 TV ads a day teaching you about wonder drugs. Drugs are going to solve all your health problems. Well, they haven't. For example, the opioid crisis that year killed 40 to 70,000 people, from prescribed opioids to street opioids like heroin, because opioids, Oxycontin, all those drugs, hydrocodone, tramadol, are medicinal heroin, and they're killing people. 40 to 70,000 a year. Nonetheless, American spine care doesn't change direction. So let me give you a little background. First of all, in 1990, it really began in earnest when Dr. Scott Bowden and his crew, he's now up at Emory University in Atlanta as the head of their director of their spine center there. He's a very famous instructor as well as researcher, and he's an honest man. He's spoken out against himself, but his first claim to fame was this study about when he found bad disc in pain-free people. It's entitled Abnormal Magnetic Resonance Scans of the Lumbar Spine in Asymptomatic Patients, a Prospective Investigation. And again, that kind of shook up the medical world. They're finding bad disc in pain-free people. What they did is they did MRIs on people with and without back pain, but in both groups they found bad discs. They said, well, if bad discs cause the pain, back pain, why do these people have the bad disc but they have no pain? Again, most back pain, 85 to 90%, according to the research, is joint dysfunctions, what we chiropractors call the vertebral subluxation, where the spinal joints get jammed and twisted. And here's a spine model. Here's a herniated disc. But again, a disc does nothing on its own. It's just a shock absorber, mostly water. So why would it suddenly bulge? Well, when the mechanics of their spine are so altered, and there's been research on that, the biomechanics of the spine. But it all starts with the joints. Here are the joints here. When they get jammed, like prolonged sitting, the buckling effect that John J. Triana spoke about, or if they just get wrenched left or right. There's many ways, of course, to injure your spine. But then that's primary, what they call the motor unit, how the spine functions physiologically. And when all that abnormal misalignment occurs, then it overloads the disc, it hits the nerve root, and where the nerve goes, you've got more problems. So, but don't be led to believe that the disc is the sole and primary cause. It's not. So Dr. Bowden started his work in 90, and 32 other studies have been done. So in 2014, the Mayo Clinic did its study. and came to the same conclusion. And this was a chart that I've shown you before, and it's just so eye-opening. I think every doctor should have this posted in his office to show the public that just because you have bad disc, it doesn't mean you're going to have pain. For example, they found that by the time you're 50 years old, 80% chance you're going to have a degenerative disc, but you have no pain. These are asymptomatic patients, right there, asymptomatic, no pain. By the time you're 70, like my age, there's a 93% chance you're going to have a bad disc, but you have no pain. So again, what Dr. Rick Deo, another researcher, MD, MPH, he's out at Oregon Health Sciences out in Portland, who's been a lifelong proponent for less surgery and less drugs. But he dubbed a phrase that I thought was very appropriate. It's called incidentalomas. You have an incidentaloma. Sounds serious, right? Oma as in tumor. Again, incidental means just happenstance. Again, just because you have a bad disc or a bulging disc or herniations or arthritis or protrusions or fissures or spondylolisthesis, it doesn't mean you need surgery. And again, the bad anatomy may not even be the cause of the problem. Because again, they're finding bad anatomy in pain-free people. And again, as Dr. Bowden found, on the other hand, you have people with perfectly healthy spines full of back pain. Because it's pathophysiology. How does the spine function is what matters, not what does the bad anatomy look like. And that's what the medical, they're caught in that model. And believe me, they can find bad disc in most everybody. It doesn't mean it's causing your pain. So next time you go to a doctor, and hopefully you don't because they have no training in back pain, primary care physicians, and he says, you got a bad disc, after you stop laughing, run out of his office as fast as you can. If he doesn't refer to a chiropractor, then you're getting misled. And they found that more and more research. Here's one. Single-level lumbar fusion for degenerative disc disease is associated with worse outcomes compared with fusion or for spondylolisthesis in workman's comp settings. This is a very famous study. You've never heard of it, because Sanjay Gupta will never tell you about it. And this study revealed rather pitiful success rates, only 36% for spondylolisthesis, which is a vertebra slip, and 24% for DDD, degenerative disc disorders. Cases were able to return to work after 2 years of recovery. 2 years later. Conversely, this means nearly 2/3 of spondylolisthesis and 3/4 of DDD patients did not return to work by 2 years. Huh? So, here's what the Anderson study concluded. Our study is support of the conclusion that DDD is a questionable indication for spinal fusion. Given the generally poor outcomes of this study, future studies should determine if lumbar fusion surgery is an effective treatment modality in similar patients, and it's not. It makes a lot of money, as I spoke about before, as I found with the Georgia State Board of Workmen's Comp. It's a billion-dollar industry, and they don't want chiropractors cutting into their market share. But you know, as I said, there are ethical spine surgeons, ethical practitioners in research who are now coming out and admitting this. Alf Nakumson, who's the father of the Spine magazine himself, he actually called for a moratorium. And others down under, Ian Harris, a famous Australian orthopedist, he's called for a moratorium. They're just saying, let's stop doing these. And then they want people to go to chiropractors and other natural healers before. And then a year later, if you're not better, then you might have the surgery. But again, here's an interesting one. Doctors with a special interest in back pain have poor knowledge about how to treat back pain. Rachel Buckbinder, who's from Australia again. I mean, the truth is slowly coming out if you read the research, which most people don't. And of course, medical doctors are not going to tell you that. But again, studies now have confirmed primary care physicians are inept in their training in musculoskeletal disorders. 2, more likely to ignore recent guidelines. 3, only 2% are likely to refer DCs. And 4, more likely to suggest spine surgery than surgeons themselves. Again, if you go to a primary care physician, they only have 4 hours training on the back, and what they're taught is wrong. Drug shots and surgeries, and don't send them to a chiropractor. So researcher Rick Deo, I mentioned before, he authored a book called Watch Your Back. And he also mentioned physician incompetence in diagnosis and treatment of low back pain. Quote, Calling a medical physician a back pain expert, therefore, is perhaps faint praise. Medicine has at best a limited understanding of the condition. In fact, medicine's reliance on outdated ideas have actually contributed to the problem. Again, Dr. Sanjay Gupta at CNN will not tell you that. Many other medical experts agree physicians are a bad choice to be a primary entrance for back pain cases. Scott Bowden, again, the director of the Emory Orthopedics and Spine Center, agreed with Dr. Deo when he said, quote, many, if not most, primary medical care providers have little training in how to manage musculoskeletal disorders, which of course is primarily low back pain. Yet, were these honest and harsh statements in the Lancet review? I'll get into that next. Were the patient panelists afraid to upset the domineering medical elephant in the room? You'll see what I mean. Again, not only are most MDs ill-trained in musculoskeletal conditions, Mr. Mark Shoney, undoubtedly the most astute editor in the spine literature, believes most primary care providers are downright dangerous. One can make the argument, he said, that the most perilous setting for the treatment of low back pain in the United States is currently the offices of primary care medical practitioners, primary care MDs, the family doctor. This is simply because of the high rates of opiate prescription in these studies. Again, if you go to a medical office, you're risking a lot. And again, this is just last month, this article appeared in the Pain Journal. And it says, primary care for low back pain. We don't know but the half of it. It's amazing. They're now starting to admit what they were trained to do was wrong. It was all political, just to railroad people into back surgeries, and they've done that. But there has been, like I say, some honest studies done. This is one of the most famous ones I mentioned before. Biomechanics of Spine, Manual Manipulative Therapy by John J. Triana. He's been a very big wig in our profession for years. He just retired from the Canadian Memorial Chiropractic College. But again, he describes a buckling effect, where you don't, it's not a pinched nerve per se, it's the joints that buckle in the spine. And all it takes is a cough and a sneeze, and that can happen. And but what finally kind of was the tipping point was in 1994, this study was done by the Agency for Healthcare Policy and Research, which was an agency of the U.S. Public Health Service. In the early 90s, when these studies started appearing, George Bush Sr. wanted best practice studies done to give doctors guidelines. And this was the 14th on acute low back pain in adults. And it shocked the medical world. It was a 2-year study, had dozens of panelists, including Triana and others. And what they came out with was stunning. It was so stunning that the medical back surgeons actually sued it to have an injunction to not have it distributed among the public. This is how powerful the medical lobby is. But in terms of this, it says here, getting relief, proven treatments. They recommend, first of all, stay away from narcotics because they don't work, but to take NSAIDs now. The new guidelines, I might add, no longer recommend NSAIDs because they found with daily prolonged use, they'll eventually dip your stomach, kidney, liver, small intestine, or cause heart problems. What I recommend if you're having a back attack is ice packs. They recommend that as well. Heater ice, or cold packs, not ice packs, applied to the back. That will just reduce the swelling. It's not going to fix you. But the third recommendation they made was spinal manipulation. This treatment, using the hands to apply force to the back to adjust the spine, can be helpful for some people in the first month of low back symptoms. It should only be done by a professional with experience in manipulation, chiropractors. I know others try to do it, but they're not trained. You should go back to your healthcare provider if your symptoms have not responded to manipulation within 4 weeks. Usually they do. They also shook up the medical world with what they said about back surgery. This is what really caused the North America Spine Society to spit up its milk, because these are, again, the head of this agency was an orthopedic surgeon, Stanley Bigos, who's out at Washington State doing great research. So here what it says right here. on page 12 about surgery. Even having a lot of back pain does not by itself mean you need surgery. Surgery has been found to be helpful in only 1 in 100 cases of low back problems. 1%. In some people, surgery can even cause more problems. This is especially true if your only symptom is back pain. So, follow the advice of the experts. Stay away from MDs, drug shots, and surgeries. Go see your local chiropractor first. But there's been other studies since then. And due to the opioid crisis, the federal government and medical associations and others started looking at why was this opioid crisis out of hand. And again, they found that most opioids are taken for back pain. And that was 30%, but 70% of them are taken for musculoskeletal, which is like bad ankles, knees, hips, necks, whatever, and which also can be treated by chiropractors. So they came out with some recommendations. In February 14, 2017, the American College of Physicians guidelines of treating non-radicular low back pain with non-drug, non-surgical conservative care were published in the Annals of Internal Medicine. That's what this is. The American College of Physicians issues guidelines for treating non-radicular low back pain. And again, they suggest non-drug therapy such as superficial heat, massage, acupuncture, or spinal manipulation. This went through the news one day and was never heard from again. But there's been others. In the same period, in April 11, 2017, the JAMA, Journal of American Medical Association study said association of spinal manipulative therapy with clinical benefit and harm for acute low back pains, systematic review and meta-analysis. That's what this one is about. And again, went through the news one day, was never heard from again. And there's been others, but one of my favorites was this one by the North America Spine Society is based, as I said, it's just back doctors, and they're the most powerful, most profitable, wealthiest of all doctors, and they have the strongest political pull. That's why when this report came out by the Agency for Healthcare, like I said, it wasn't released for 6 months because they filed an injunction. Finally, the judge released it, and but they tried their damnedest. And what they did is they actually got the agency out of the guideline business, which is what George Bush Sr., president, wanted them to do. So the North America Spine Society finally sobered up, and they have published 2 studies I'd like to share with you. Clinical guidelines for diagnosis and treatment of lumbar disc herniation with radiculopathy. This is also the diagnosis and treatment of lumbar disc herniation with radiculopathy. And this was done a few years ago. And this caused quite a stir, but again, you've never heard about it. But the question is, what is the role of spinal manipulation in treatment of lumbar disc herniation with radiculopathy, which means pinched nerves causing sciatica, to use lay terms. And this was interesting. The authors concluded that of patients with sciatica that failed 3 months of medical management, which is over-the-counter pills and muscle relaxers and shots and typical stuff, 60% will benefit from manipulation to the same degree as if they undergo surgical intervention. Although this study is a randomized control, it provides case series therapeutic evidence that spinal manipulation is beneficial in treating patients with lumbar disc herniation with radiculopathy, in other words, sciatica or leg pain. So again, if you have this, don't jump into the surgeon's office. Come see us first. And as they said, 60% will benefit. Now that was just with manipulation. Let me add to that. This did not include spinal decompression. In other words, the DRX 9000. And my protocol is when people come with low back pain and sciatica, I put them on flexion distraction tables and do the classic side posture spinal manipulation. And again, for 60%, that works well. But if my patients aren't at least 50% better after 2 weeks, then we talk about putting them on the DRX. The flexion distraction tables, the brand name is the Cox treatment, which is very good. James Cox is a great chiropractic warrior researcher. That pulls at 50 pounds per square inch on the spine, which is enough for most people, 90%. But for the 10% it's not enough. The DRX 9000 will pull for at least up to 150 pounds per square inch, and you're on that for 30 to 45 minutes. And again, they're getting 86 to 90% success rates, non-surgical, on these patients. So that's what I tell people. Let's start with the cheapest and quickest things first, and then work up to the more involved and the more expensive spinal decompression. The second study done by the North America Spine Society was diagnosis and treatment of degenerative lumbar spinal stenosis. Now this is where the spine is just developing so much arthritis, the canal is starting to shrink, and then it's causing back pain and other problems. Now, the medical solution, again, I told you most back pain is where the joints are jammed up. Well, one way to restore joint play, by restoring joint play, is to restore the normal function of joints. Here's what a laminectomy does for stenosis, where they actually chop off the back half of the vertebra. You can see it's just not there. That's one way of removing joint problems, is remove half the joint. Of course, it doesn't last, and it's very expensive and very disabling. So what did this study find? The authors reported mean improvement in that was score was achieved by 66% of patients. The long-term follow-up current pain decreased by a mean of 38%, average pain by 51%, and the self-rated improvement was 75.6% overall. 3/4 of patients who did the chiropractic approach got better. And then, like I said before, if they stay on a maintenance program, they'll stay better. And what was interesting is a friend of mine, Dr. Donald Murphy, up at the Rhode Island Spine Institute, he was involved in this research. And when it was first published, I wrote him a congratulatory note saying, great going. And I said, but tell me, Don, after you did your magic, which was flexion distraction table and spinal therapeutic massage, I said, even though those people were feeling better, they still had spinal stenosis. Just like after we adjust people with degenerative disc or bone spurs, we adjust them, they feel better, but they still have all that arthritic garbage in there. And he wrote back to me, he says, bingo, JC. He said, this is what he keeps trying to tell the surgeons. It's not patho-anatomy, bad anatomy that's causing the problem. For the most part, it's bad physiology. So by inducing joint motion, core strength, flexibility, decompression, these people get better. Now, if they maintain that protocol, they'll stay better. If they don't, like I say, if they become the prodigal patient who just stops everything because they're feeling better and go home and sit all day just jamming their spine, yeah, they're going to relapse. It doesn't mean you do surgery. It means get back and stay on the program. So there's been a lot happening, but in 2018, perhaps the most significant study was done and published in The Lancet. This Lancet, you may not know, is the second oldest medical journal in Britain. It's very, very prestigious journal, but they did a 3-part study. The first one was what low back pain is and why we need to pay attention. Professor Jan Harbitsen, he's up at the University of Southern Denmark, bigwig in our profession. The second is Low Back Pain, A Call for Action by Professor Rachel Buchbinder. She's down in Australia. And the third part was Prevention and Treatment of Low Back Pain, Evidence, Challenges, and Promising Directions by Professor Nadine Foster, also down in Australia. There were 31 international researchers and editors who were on this. And it was a 2-year study, and the key messages, again, shocked the medical world because they didn't want the cat out of the bag that what they're doing isn't working. But here's what they talked about: addressing quote-unquote widespread misconceptions in the population and among health professionals about the causes, prognosis, and effectiveness of different treatments for low back pain, including fragmented and outdated models of care, opioids, spinal injections, and back fusions. That's what they were talking about primarily. And it appears the panel failed to consider the backstory of the widespread misconceptions, as I wrote, that did not develop overnight but evolved from the fallout of a century-long medical war against chiropractors to oppress chiropractic with dirty political tricks, propaganda defaming chiropractors via public humiliation in the media in order to create the present medical monopoly by containing the main competitor in the lucrative 100 billion spine market. The outdated models of care about medical spine care have already been deemed the poster child of inefficient care by Lancet panelist and editor of the back letter, Mr. Mark Shoney. Yet these outdated, dangerous, expensive, and most ineffective medical models for 90% of cases still predominate, despite such warnings that never seem to reach the public via the mass media or via the primary care providers. This is the biggest cover-up. That's why, if you want to read more, I say go to my article, in which I talk about this scam continues. And unfortunately, the boycott of chiropractic remains persistent with most MDs, according to an article, Managing Low Back Pain in the Primary Care Setting, the No-Do Gap. Manipulation, they said, which is supported by most guidelines, is recommended by PCPs, primary care physicians, in only 2% of acute, non-specific low back pain cases. Again, MDs aren't going to tell you the truth. That not only is it unethical, considering all the research, but it's illegal. There's this doctrine of informed consent. It's a state and federal law. You have to be told options. And if you're not told the options of chiropractic, then your doctor has broken the law. And this court cases have been already covered this, and I hope you file a suit if that's the case, especially if you got railroaded in surgery that failed. And if the primary care, the pain management clinic physician injecting you with drugs for, back pain, and the spine surgery, if none of them told you about chiropractic care, then you have a case. The Lancet panel all described the continued dilemma in spine care, including the gap between evidence and practice. In other words, the medical covert boycott of the guidelines. Quote, low back pain is now the #1 cause of disability globally. Although there are several global initiatives to address the global burden of low back pain as a public health problem, there is a need to identify cost-effective and context-specific strategies for managing low back pain to mitigate the consequences of the current and projected future burden. Despite many clinical guidelines with similar recommendations for managing low back pain, the gap between evidence and practice is pervasive and is only growing. And again, the Trump administration also produced this study about opioids, and they also found that chiropractic was a good non-drug solution. The President's Commission on Combating Drug Addiction and the Opioid Crisis, this was headed, you may remember, by Governor Chris Christie. He was the chairman. Excellent report. I encourage you to look at it. But again, there has been a trend to exposing this. This is an interesting article. Opioids, injections, and scans of dubious benefit harming 540 million back pain sufferers worldwide. I mean, this is the truth. But have you ever seen this in American media? I don't think so. Most of this is occurring in Australia, Canada, and Britain. Hundreds of millions of back pain patients worldwide are being aggressively treated with strong opioids, surgery, and dubious scans of dubious benefit, the doctors have warned. But again, no one's telling you. Here's another one from The Conversation, which is another Australian. The guidelines on low back pain are clear. Drugs and surgery should be the last resort. The last resort, not the first. Here's another one. Back pain is being mismanaged with ineffective and harmful treatments, experts warn. How come your expert, your local family doctor, or pain management doctor, or surgeon haven't warned you? Is this not a cover-up? Is this not unethical and illegal, or what? Here's an interesting from the PN Pharmacy News, which is interesting. How did low back treatment go so wrong? It's amazing. People are honest, ethical spine practitioners are now telling the truth, yet it's not getting to the public. Here's an interesting one from the Sydney Morning Herald. Thousands of back pain sufferers given harmful treatments. I would love to see this in Atlanta Journal-Constitution, the New York Times, and other prominent mass media. But again, they seem to overlook it. Here's an interesting one. We're treating lower back pain all wrong. Here's how to do it right. And again, what they mention is the same thing in the guidelines. Natural, hands-on, non-surgical, non-invasive, non-drug. which is what we do in the chiropractic profession. And I think this is my favorite. This, again, just came out a month ago. It's from the Pain Journal. Again, primary care for low back pain, we don't know the half of it. I might say they don't know 3/4 of it. So, like I say, I try to get you up the learning curve. Again, if you want to know more about all this, you might buy my book. It's cheap at twice the price, and you'll enjoy it. It's a good read. Otherwise, I want to thank you for listening to my latest rant, and I'll see you next time.